Hello again, and welcome back. And today I am going to take a deeper dive into defining what is this therapy that I do, intimacy behavioral therapy. I look through some of my videos, and while I do give it a good explanation, I feel like there's something missing, and I want to go a little bit more into it. So, um, and how it's different from other kinds of therapy that's out there. So I'll start with just the name that I gave it. So intimacy behavioral therapy. So it's a form of behavioral therapy. Mm. And what that means is that through the tools that I've talked about, it seeks to help people replace the fight, flight, freeze, and anxiety responses from within their bodies with ease and comfort and connection and trust and intimacy through all of that, so that they can develop intimacy first with their own bodies and what they're feeling, and then be able to translate that into connecting with another person, which while they're in therapy with me, they're actually practicing, since I am there with them and engaged and normalizing their experience, really going into the trenches with someone. So I'm now remembering, I really want to try to speak more to you directly who's listening to this. So I'll continue by saying that this therapy really, its key focus, its key focus is really to help through coming through this process, whatever brought someone in, whatever their challenge or problem that they're trying to overcome or change or learn, any of these things, at the base of it, it really seeks to help people discover how to access the tools for themselves, right? So that that's the behavioral part, that they actually learn these tools, learn how to use them with enough consistent practice with me in the therapy 3 to 4 months, and then develop the confidence through the process of knowing that they are, you are, I'll say, able to call this new behavior forth that has now become new neural pathways in your brain from repetition, on your own, so that it's not reliant on me. It isn't necessarily has to be a long-term kind of engagement in therapy, although it does take time. But because the focus is really about giving people access to their own tools that they already possess, awakening to them and discovering them. Therefore, it is very empowering, and it is something that certainly creates and engenders much more of a deeper kind of trust. Well, interesting I said that, because it's through touch that one can really expedite, if you will, and go deeper into trust building than with talk therapy alone. So I want that to be really clear, because the body has its own wisdom and intelligence and takes time to open and trust and shift. And through the discovery of what one's really feeling in the moment, physically, sensation-wise, moment to moment, emotions are tapped into as well. And it is through our emotions that we heal, once we release them and let them go, and then refocus on the present moment. So I really just want to, I hope that I've clarified a little bit more how this therapy that I've created is really focusing on giving people the ability to do this on their own, into the future, rather than having to depend on the sessions continuing into the infinite future. Now that said, there are people that do benefit and need longer term intimacy behavioral therapy. Some do, but this was designed so that most would be able to gain what they need, so that they can apply it to pretty much all the different issues that they come in with, right? So premature ejaculation and erection issues, losing erections, delayed ejaculation, late bloomers, people who are, socially maybe stunted a bit, feeling ill at ease within themselves, so sexually inexperienced, all these things that I've helped people to overcome through this therapy. So thank you. I wanted you to hear that. Thank you so much.